Hey guys, I'm Gina, and this is the sound I sleep to most nights because I room with someone who snores. And despite the fact what people might say about snoring, it doesn't affect just the person you wake up, but it also affects yourselves. So if you snore, you have a greater risk of having serious health problems. The American Academy of Sleep Medicine estimated that 30 million Americans have the risk of snoring. That's 1 out of every 8. So today I'm going to discuss the causes, the health risks, and the treatment options of snoring. So what causes snoring? Well, when you go to sleep, your muscles in your body are fully relaxed. And more specifically, the muscles of the soft palate and the uvula are relaxed to a point where airflow comes and affects the soft palate, which makes it vibrate softly. And that's the lovely sound that you just heard a few seconds ago. So the American Academy of Sleep Medicine associates snoring with sleep apnea. Can anyone tell me what sleep apnea is?
It's when you stop breathing while you're sleeping.
Right. And so let's check this out. 18 million people have sleep apnea, but 12 million of them don't even know that they have it. What causes sleep apnea? Well, the muscles of the throat and the tongue collapse, and then there's a blockage. And that blockage can last up to 10 seconds or even up to 2 minutes. And then your brain is triggered by, hey, I can't breathe, I don't have enough oxygen. So then you gasp for breath, and then the cycle repeats. So then what happens is your sleep is disrupted throughout the night. So the next day, you feel drowsy, and then what happens? Problems can happen, for example, a car accident. So who snores? Men, women, well, we all do. But did you guys know that men snore 2 times more than women? And also, age plays an effect too. If you're 50 or older, it's a higher chance that you have a risk of snoring. And also, weight plays a role too. If you're overweight, you're more likely to snore. If your BMI or your body mass index is 25 or greater, you have a risk of snoring. And also for the guys, did you know that your neck size also plays a big role? If your neck size is 17 inches or greater, you likely are snoring. So we know snoring interrupts sleep. Now I'm going to talk about the health risks. So our body needs oxygen in order to function. You need it whether you're asleep or you're awake. So if there's a shortage of oxygen, then there's going to be an increase in blood pressure. And the American Sleep Apnea Association says that 50% with sleep apnea will likely have an increase in high blood pressure. And an increase in high blood pressure means that there's an increase in heart attacks, heart failures, and strokes. So the risks get serious, but the good news is that there are treatment options. For example, if it's severe, there's surgery. If it's moderate, there's things called impact devices. And if it's mild, there's dental appliances, or you can just lose a little weight. So for severe cases, there's surgery. And what happens in surgery is the muscles and the tissues in the tongue are kind of trimmed off. And that causes the airflow to flow by more easily. And for impact devices, the most popular one is called a continuous positive airway pressure, also known as CPAP. And what happens is oxygen flows through the nose of the person, and then this will help the person breathe and eliminate snoring. And for mild cases, there's dental appliances, and with this, the upper jaw is connected to the lower jaw. And then there's a key that you can turn that protrudes the lower jaw so that the airway passage is open more. Or if you lose at least 5 to 10 pounds, that can affect your snoring easily. It can ease the snoring. And so let's just review what I talked about today. Snoring interrupts sleep, which causes health problems, but there are treatment options to minimize risks. So if someone tells you that you sound like this, they're supposed to be snoring, but see your doctor. You'll sleep better, and it may even save your life.